Hey everyone, it's me. Yay! Dr. Whimsy, your favorite naturopathic doctor. And today we're going to have a really casual conversation about a really important topic, and that is stress. How do we reduce stress, and why is reducing stress so important to our health? I would have to say that stress not only is a key factor in the disease process, but I really believe that if the alternative healthcare provider can focus predominantly on stress reduction, they can do amazing things in terms of improving the health of their patients. Chronic stress is something I see in probably the majority of the people that come to see me, and so consequently, a lot of what I do here in my office is focused on creating an environment that dramatically reduces stress. Everything from the fountain with the water dripping that you hear in the background, to soothing music that we sometimes play, to the images of the art that I've selected, which are forest-based, and the reason that I chose a forest theme for the office is because of this idea of something that's called forest bathing, the ability to see how time spent in nature actually will reduce stress. So everything in my office is put in a particular place, in a particular way, in order to alleviate stress. Some of the other things I do in my offices are that I use a lot of aromatherapy. And again, it's because we understand that certain smells or scents will also dramatically reduce stress. If I were going to give some advice to somebody who was wanting to reduce stress pretty quickly and they wanted a natural protocol to do that, I would say first and foremost, the first thing we talk to people about is drug and alcohol abuse. We are really strong proponents of sobriety here at my offices, and we spend a lot of time talking to people about the importance of being clean and sober. And that is because if a person is trying to heal their life and gain some control over their life, first and foremost, they have to be in control of their own mind. And the beginning of healing, the beginning of taking control over our lives has to start with the brain. It has to start with our ability to focus and take some control over the health of our brain. Even recreational drugs, which have become legal in the state of California, I'm pretty cynical about. Just because I've seen and treated too much depression due to chronic marijuana use. And again, it has a profound effect on the way people think and the way they look out at the world. And again, that can have an impact on stress, the ability to handle stress. If every time you're in a state of stress, you go to consume alcohol or a recreational drug, that's not good stress management. So that is the first conversation we have is about the importance of sobriety. The second thing we do is we talk about giving people the tools in order to de-stress as naturally as possible, and that means getting a good meditation practice going about once or twice a day, giving yourself permission to stop for about 20 minutes twice a day to experience meditation. I prescribe transcendental meditation actually as part of my medical protocol, just because I want to see stress levels get down in my patients. Simple exercise that is not necessarily particularly difficult or rigorous can be incredibly beneficial for stress reduction. Going for a calm, easy stroll, walk, can reduce stress, particularly if you're doing it in a natural environment, spending time in nature. Certain foods have been found to be helpful for reducing stress, believe it or not. Not consuming foods that are high in sodium, Foods rich in sodium can actually increase blood pressure, and that can cause stress. Foods high in caffeine can sometimes cause stress. Of course, we've talked about drugs and alcohol. Consuming too much alcohol can also cause stress. Eating a lot of meat for some people has also caused stress and anxiety. There's been some interesting clinical studies that show that people who are on a vegetarian diet can sometimes see a reduction of stress. Getting adequate sleep is a conversation that I have a lot with my patients, making sure that they get to bed early. Treating your sleep and your sleep patterns as part of your medical protocol is something I cannot emphasize enough here during this video. And finally, one of the things I like to do is I like to do body work, shiatsu, acupressure, and healing touch therapy. Healing touch therapy is now approved for continuing education for nurses and healthcare providers, and that is a gentle technique where we simply move the energy and send calm energy to the patient. I also like to do shiatsu and acupressure. It's more of an Eastern way of working with the body, and it's part of my training as well. In addition to all of that, we do supplement depending upon the individual needs of the patients. I like some of the herbs that have been used for stress. St. John's wort has been effective in helping to reduce mild cases of depression in clinical studies, but we also get great results from oat straw and passion flower. And sometimes when you get the nervine combinations, you'll see all three of those herbs in combination. I like companies like Herb Farm. I also really like Wise Woman Herbals. I think they do some great combinations. B complex in the coenzyme form I often will prescribe. I try to emphasize more the B6 than the B12, which can sometimes raise adrenaline and cause anxiety. Magnesium, particularly at night, can help with sleep and also reduce stress. Lithium, believe it or not, lithium is an antidepressant. It's a naturally occurring mineral. It was first discovered from mineral baths, and in low doses can be used for some cases of stress and anxiety. Amino acid therapy is also something that you may want to talk to your naturopathic doctor about, particularly if they've done a neurotransmitter panel that's a urine panel. This would be an example of a panel that we would do here in my offices. We can check your hormones, your cortisol, but we can also check your urine to see how your neurotransmitters are doing. If it tells us what we need to know, then we can supplement with the appropriate amino acids. L-theanine can be helpful for stress. I really, though, think that, as a medical minimalist, the best way to reduce stress is to really learn healthy habits every day. Massage, getting a massage as often as you can, either from a partner or by coming into my offices and getting a shiatsu massage. Sleep, we've talked about meditation, those daily healthy habits. And that's really the way a medical minimalist would think, not fads and not something that's going to be popular today and then not popular tomorrow. Medical minimalism is really looking historically at the data, looking at the data, what makes us healthy and what maintains our health, and really encouraging people to make small, simple steps consistently every day in order to improve their health. And top of the list, absolutely, is stress reduction. Stress reduction, I cannot emphasize it enough. It reduces risk for chronic disease, blood pressure, and all of the increased blood pressure and all of the health consequences that can come from elevated blood pressure. Stress is also associated with poor immune function. So there are all kinds of health challenges we see when we have increased stress. The last thing I would say, if you're really concerned about stress and the impact of stress, two things I would talk to you about. The first is learning to let things go, and that's a big challenge for me, and I'm sure if you're like me, that can be a challenge for you as well. Not sweating the small stuff, and learning to let things go. The ability to adapt to new situations or stressful situations, taking a breath, going with the flow. The last thing I talk to people about is the importance of not living beyond our means. Gaining control over our finances, believe it or not, can have a dramatic impact on stress reduction and health. When we feel that we are in control of our finances, when we've got a budget, when we're living below our means and not trying to keep up with the Joneses, that is incredibly helpful if we're talking about stress reduction, particularly here in Los Angeles, where I see people working 2, 3, 4 jobs simply to survive. So minimalism in medicine are definitely associated with stress reduction. All right, I want to thank you for watching this video on the importance of reducing stress, and it gave me an opportunity to talk a little bit about the idea of medical minimalism. All right, thanks for watching. My name is Dr. Whimsy, and I am a medical minimalist. Take care. Bye-bye.